Hi, I'm Paul Silovsky, physical therapist and owner of Rebound Physical Therapy, and I wanted to talk to you today about how physical therapy is used to boost and or accelerate your innate ability to heal. First of all, what is physical therapy? Well, look, we are experts in movement and function and helping you decrease pain in your everyday life. We're able to apply physical measures, meaning exercise, hands-on therapy, along with modalities like heat, ultrasound, and electrical stimulation, laser, those kinds of things to decrease inflammation while you're healing. Now, let's jump into this healing process and how we accelerate that. Look, it's really simple. The body will definitely heal over time when there's been injury, insult, post-surgery, stuff like that. But what a physical therapist and or physical therapy does is help organize that process and not allow time to harm you. In other words, time can be your friend or your enemy depending on how you approach the process. The process is super important. So we get all of your systems working together while you're healing, we get all the systems working together while your body is going through that healing process. And what do I mean by systems? I'm talking about the muscular system, the skeletal system, the neuromuscular system, the communication between the nervous system and the muscles, the cardiovascular, heart and lungs. All those things have to be working together well in order to optimize healing. I look at it this way. The physical therapist is your guide to getting to where you want to go. We just accelerate that process. We want you to enjoy the journey, have more fun, and the more you know about how to navigate through that process, how things work, and how to get there faster and stay healthy makes a huge difference. That's where the PT comes in. Now, let me talk about these stages of healing. There's 3 stages of soft tissue healing that are really important for, to align with your physical therapist. The first one's the inflammatory stage, the most obvious. You have an injury, an insult, it's kind of like when you get a cut, right? It gets red, things are inflamed for a few days, it's really angry, just kind of pissed off, right? The body is sending recruits to the area to protect. Pain's not actually a bad thing. Pain's there to protect you. But during the first 72 hours, things are inflamed, they're swollen, lots of blood come into the area to assist with healing. So that's the time where we work on decreasing inflammation after an injury. Ice, electrical stimulation, protective measures to keep you safe while the body's doing its thing. Now the second phase, which is called the repair phase, I like to call it the organizational phase, is from that 72-hour period up to about 6 weeks. This is when the body's laying down scar tissue, laying down healing properties to help the body become stronger again and heal the area of injury or inflammation, right? You got this inflammation, it brings all the recruits in, and then it's laying down scar tissue. Super important time to get organized, because listen, if you were laying down all kinds of scar tissue in all kinds of directions and it was disorganized, when you go to move that, if you waited for 6 weeks and didn't do anything, it's going to be very angry, not going to function very well, and it's certainly not going to be very organized. Your body's not going to know how to move right against those restrictions. So that's when we get most of our work done, from 72 hours to up to 6 weeks after the injury. That's where we do our best work in organizing those tissues, organizing that healing process with movement, exercise, and those modalities I mentioned before. Now the last phase, another really vital stage over the long term, this is why you don't want to give up and sometimes you need to update your program, it's called the remodeling phase. That's when you take all that scarring, all that tissue that got laid down to make you stronger and heal back, and you strengthen the integrity of the tissue. Let's say you had a ligamentous injury. I had injured a ligament in college. This can take anywhere from that 6-week period after the rebuilding phase, right? We go into the remodeling, go from repair anyway, or rebuilding to remodeling, 6 weeks to 12 months to completely strengthen the integrity of ligaments, tendons, muscles that have been injured. That's where we put you on the home program and periodically progress you so that you get back to total normal function. Look, the PT knows what to do in every phase, how to optimize the time and optimize your ability to heal in each phase, especially when you have a setback. Look, you can overdo it for sure, but you definitely, overdoing it once in a while is not a bad thing, because sometimes you can, make the body angry even when you're repairing, and you overdo it a little bit and, oh man, it's really inflamed again. Well, good. We can help you get that inflammation down, get you back into the repair phase faster, and move on through it. I'd rather have someone overdo it just a little bit once in a while than do nothing and underdo it, because it's much more difficult to rehabilitate someone that's waited too long and not doing anything, because you want to optimize your ability to repair yourself. And we're the experts to help you do that. So in closing, if you had an injury, surgery, or chronic pain, we can help you get better faster and more safely. Call for more information on what can be done to get an evaluation. It's never too late to be your best and get back in action. We look forward to seeing you soon.